Hello, I am Dr. D Rajendaran. Currently, I am the Medical Director of D Eye Care Center located in Madipakam. World Sight Day is celebrated worldwide on the second Thursday of every year, October month, to create our awareness among people about preventable causes of blindness. And in India, almost 1/3 of world's blind patients are there in India, and among them the most common cause of preventable blindness in Indian population is cataract. Cataract is usually a aging disease wherein normally the crystal clear lens, like what we have in a camera, we have a lens in our eye. It's crystal clear and it focuses the images, whatever we are seeing, onto the retina. Because of aging, that is the most common cause, that lens loses its transparency. And there are other causes also, like a trauma, an injury can cause cataract. In childhood, because of poor nutrition of the mother, or during pregnancy if the mother encounters some viral diseases, or if the mother gets some hypothyroid problem or any other vitamin deficiency, those sort of things also can cause cataract in the child, in the immediately after birth, or when the child is growing, he or she might develop cataract. And the other causes, some of the drugs, some of the medicine which are taken for allergy, asthma, or connective tissue disorders like SLE, rheumatoid, for those we have to take some medicine for a long period. Those sort of medicine can also cause cataract. And irradiation can be another cause for cataract. If one person gets cataract, what are the problems he will get? A main problem will be blurring of vision. The vision may not be very clear, the vision will not be very crystal clear. Depending upon the site of the development of cataract, sometimes the patient might have difficulty only at night while looking at the opposite lights, or while driving against sunlight, the patient might experience some difficulties. Some patients might feel like some screen in between the objects and him. The patients might feel something objecting, something hiding his view, or blurring of colors. Colors may not be as bright as they are. These are all the problems you usually get, and over a period of time, totally the vision will go. If cataract is neglected, the patient may not be able to see anything. He might develop almost blindness. So when patients start getting the blurring of vision at the early stages itself, if they consult their eye doctor, the eye doctor will be able to diagnose the problem and give the solution. In the very early stages, glasses might work, but the main treatment for the cataract is cataract surgery. Surgery for cataract has been revolutionized by the invention of IOLs, and with the latest techniques like phacoemulsification and femtosecond laser cataract techniques. So with so many techniques, now the cataract surgery has been very much simplified, and it's almost a day-care procedure where the patient can walk in and immediately after surgery can walk back, and within a few days of rest he can resume his routine activities. And with the advent of latest IOLs, that is, IOL is an intraocular lens. Usually what we do in cataract surgery is we remove the cataractous lens, leaving the outer shell of the original lens. All the material of the lens is removed through laser or through manually or through phacoemulsification techniques. And after the removal of cataract, if we just like that leave it, the patient will not have a very good vision. He will require a very thick glass we call it as aphakic glasses, very thick glasses. Those days, before the invention of intraocular lenses, we could have seen some old, grand old patients wearing very, very thick glasses after cataract surgery. Those days, there is no other go. After removal of cataract, the patient has to use a thick glass to get a good vision. Now, with the advent of intraocular lenses, we need not have to go for very thick glasses after the cataract surgery. And those who have a cylindrical power, we have special lenses called toric lenses that also can be corrected, so that a patient can get a very clear vision after cataract surgery. And with the advent of multifocal or accommodative lenses, we even the near vision, like reading and mobile, looking at the mobiles and all the other computer tasks, all those things the patient can do without the glass, without the need for the glasses. So now with the latest techniques, patient is able to get almost a very clear, crystal clear vision for distance and for near with the advent of latest techniques and latest IOLs. So first thing is to recognize the problem. Whatever the problem you get, don't ignore it. Immediately get the go and meet the nearby eye doctor and look for his medical opinion, diagnose the problem and look at the remedy at the earliest. If the cataract is left for a very long time and if it is not removed, it might give complications like the secondary glaucoma or other complications. So it's better to diagnose early and get the treatment to avoid permanent loss of vision. Thank you.